Welcome back to Sarah Has Questions. It's season 6. I can't believe it's season 6, but here we are. And our first episode is going to be so fun. We're talking to a pharmacist. I have a ton of questions, so I'm going to get right into it. I'm Sarah King, and I have a lot of questions. In this show, I get to ask WakeMed doctors any question I want, and bless their hearts, they have all the answers. Sarah Has Questions is a production of Mix 101.5 and Capital Broadcasting Company, and it's presented by WakeMed. We have never had a pharmacist on the show. I'm very excited, and I have lots of questions, obviously. So welcome, Dr. Mary Covington Coleman with WakeMed.
Thank you.
Yeah,
Thank
you're a hospital pharmacist, too.
Yes. So I work with women and children in the pharmacy at WakeMed.
Oh, that's cool.
Campus. Yeah.
All right. Well, let's jump right in. We have a lot of questions today. As patients, you have specialists and your general practitioner and yada, yada, yada. So many doctors, but only one pharmacist.
Mm-hmm.
So what are your insights when you're getting all these prescriptions from all these different specialties about medicines that work together and don't work together? Like, do you ever see that clashing?
Yes, that's a great question. I think that's where pharmacists can play a huge role in management of medications for patients because they are seeing multiple different doctors for various reasons. And, pharmacists, we are trained to look at the whole picture of your meds, look to see if there's any drug-drug interactions. Is this working? Is this not? Because that's what we're trained to do. We are trained to know the medications, whether they're being effective or are you having side effects or an allergy. That's sometimes people are like, oh, this med upsets my stomach, I'm allergic. Well, that's not necessarily an allergy. It could just be a side effect of the medication. Right. So how do we clarify what those are? So pharmacists are really good at helping you with med management, looking at the whole picture. Whereas like providers, they are mainly focused on diagnosing you. Like, what are your symptoms? You have X, Y, and Z. And
Gotcha.
so pharmacists have been trained to kind of help you with the next steps with the meds.
Okay. So is that why it takes so long when you drop off your prescription? Like, is that why it takes like 20 some minutes or so? Because you would think you just go back, grab the pill bottle off the shelf, and then fill the bottle.
All the things. Yes.
So that's part of the reason why.
Yes. Obviously, when we have so many meds back there, so you have to make sure you're picking the right one. And now we have so much, before when I was in pharmacy school, it would be like counting them and like looking at it. We have scanning technology, barcode scanning. So scanning the right med, making sure it matches with the prescription. But then, yes, the pharmacist check is making sure that kind of everything looks right. Is there anything that we need to speak to the patient about when they come and pick up their meds, interactions, or that kind of thing?
Okay.
So, yeah.
Interesting. Mm-hmm. What are we not asking enough?
That's a great question. I think if you have a simple question as far as certain meds you need to, be covered in the sun when you're taking it, like doxycycline is an antibiotic that people often take. And so you just want to make sure that you are wearing the appropriate sunscreen and coverage when you're out in the sun. But one-off question. But if it's a patient, like some of our elderly patients that have are on 10 different meds, you can actually make appointments with pharmacists.
Do a lot of elderly people know this?
Well, I hope they do. Or the pharmacists, different pharmacies, outpatient pharmacies offer like medication management sessions where you can sit down with the pharmacist. They'll look through your list and be like, hey, are these working? What side effects are you having? And then they can provide you information and questions to go back to your provider. We can't obviously prescribe. That's not our role, but we can help you ask the right questions when you go back to your physician.
So helpful.
Yes.
Well, and that's something I've learned from doing this podcast is that you can even do that with a physician.
Yep.
You can call and make an appointment just to ask them questions.
Yes.
Yeah.
Yes.
And like nobody, as a layperson, that is something you think you have to have a purpose. There has to be a red flag that you're trying to deal with.
No. You can, and outpatient pharmacies, that's, a lot of their time is often pharmacists spent talking to the patients about their meds. And like sometimes we have a whole program. Okay. We even have that program at WakeMed through our outpatient pharmacy.
And when you're saying outpatient pharmacy, what do you mean by that?
Great question. So everybody thinks of like your CVS, your Walgreens. Right. At WakeMed, we have an outpatient pharmacy at our Raleigh campus. campus at our Cary campus. So you can get, when you're discharged from the hospital, you can get your enalapril or whatever you're discharged with. Inpatient pharmacy, which is what I trained to do, is the actual pharmacy in the hospital.
Oh, okay.
That dispenses your meds, reviewing your profile to make sure you're on the right med in the hospital.
That makes sense.
So 2 different types of training for different pharmacists.
Interesting.
Yes.
As a pharmacist, what question do you hear the most? Or questions? It doesn't have to be just one.
Well, so one, I'm pediatric trained, so but my family and friends text me, "What can I take with alcohol?" So that's probably a lot.
These are real life questions.
Yes. Can I take this with that? Does this interact with that? That kind of thing. But on the inpatient side, it's a little bit more acute situations or acute issues that we're dealing with. But from an outpatient side, I would think the alcohol question.
It's a good question.
Yes. Can I take my brother's
Right.
all those things. And
can I take my brother's? So is that a common thing to like, my mom has some leftover, yada, yada?
Yes. And the answer is no.
Yeah, no.
Because, medications are so complex. So we obviously, that was prescribed to you, Sarah, and we looked at your body composition and your other meds that you're taking.
Right.
So if your uncle comes in and needs it, he might be on different meds that could interact with the med you were taking. So you do want to formal assessment of a med before taking it.
Yeah.
By yourself.
Okay. Well, let's talk about generic versus name brand.
Yes.
Because I know, and I won't say the product.
Okay.
But I do know a friend of mine toured
No
a
sponsors
factory.
here.
Yeah. Toured a factory. And in that factory, they were using same equipment, same recipe for the generic, just a different label. Yes. Is that the same thing in medication, or do they actually have completely different factories and they're making, are they making the exact same drug, or are they a little bit tweaked?
That's a great question. I guess maybe step back and say, what is a trade versus a generic? So a name brand drug. So Sarah company created a drug, went through all the R&D. I'm not an industry pharmacist, but you came up with this new drug. Then you apply for a patent. And so for X number of years, 7-10 years, Sarah is the only manufacturer of that drug. Okay. So nobody else can make that drug because you were smart and you figured out the cure to Botox. I don't know,
whatever. For the course,
for elderly, for wrinkles. I don't know. And so, but when that patent is done, other manufacturers can take that recipe, tweak it, and produce it as well.
But they'll tweak it.
They will tweak it. But they'll be tweaking the inactive ingredients, not the active ingredient.
Why?
It could be for various reasons.
Okay.
When they're processing and they're manufacturing. But yes, those are the usual differences between generic and brand. And so, yes, they're 100% efficacious because it's the same active ingredient. So whatever drug is doing the, what your body needs in that particular drug. The inactive ingredient is what gets people into trouble. Like, hey, I can't tolerate a generic. Yes.
That was my question because I have a lactose intolerance and I know that some pills use milk.
Exactly. Yes, exactly. Certain allergens or whatever sensitivity. So yes, that some people are like, I have to have brand name. And that is 100% true, and it happens all the time, inpatient and outpatient.
Interesting. Okay.
And it's usually due to the inactive ingredient.
Gotcha. Okay. The fact that you have to know that too.
We don't know a lot, but pharmacists are really good at finding answers. So.
Okay. This is for a woman who works here. Her name is Jamie. I'm going to call her out.
All right, Jamie.
Do medications really expire on the dates
that
are on the bottle?
That is such a great question. And I have a professional answer and a personal answer.
Oh, Lord. Well, let's hear both of them.
The professional answer is yes, you should not take a medication past their expiration date. My husband is to the T. I take expired meds all the time. But I'm also, I know where the beyond use date comes from, right? So I'm a drug company. I make a bottle. I did studies to give it that dating. It came in its original container. And then you have a pharmacy, an outpatient pharmacy that takes that medication out of the original container and puts it into their prescription bottles.
Right.
And then that gets a date.
That's different from the bottle?
Yes.
Oh, interesting.
Because we have regulatory Board of Pharmacy laws.
Okay.
Okay. And so then you're okay, it expires. You probably shouldn't take it. But me, I'm thinking, okay.
You know the original date.
But I don't always know the original date, right? Because you're not looking at the bottle.
Sure.
But it could have been had 5 more years left on it, or it could have been like, this is a year. So you don't want to take that risk. And the reason why you don't want to take the risk, so I'm being silly because I take expired Tylenol all the time, but efficacy, right? So the longer it is past its expiration date, it's not going to be as effective. So,
right. So what's the point?
Yes. Or, and if it's like a dire need and you have a migraine, you have to take your meds. But then safety, there are some meds that you should never take past the expiration date. It could be harmful. Yeah, like tetracycline's a med like that. Like you never, and so
I've taken that one before.
Expired?
No, just in general.
Okay, don't take it expired. But like,
I don't take expired meds.
Oh, well, you follow the rules.
I do.
Usually, I'm a rule.
I'm not typically a rule follower, but with medications,
yes,
I don't understand them enough.
You should. So, I have a background in pharmacy, so I can.
Yeah, you can wiggle around a little bit.
I can wiggle, but yes, do not take your meds past your expiration date because you just don't know.
That is sound advice.
Yes.
All right, we're going to move on to a type of pharmacy that I've used once to get some kind of ointment back in the day. What is a compounding pharmacy?
That's a great question. A compounding pharmacy is a pharmacy that basically produces medications that need manipulation. So it's a product that you need as a patient, and there's no commercially available product option on the market.
Why would there not? Because it's in testing still? Like, how do you even know you need it if no one's making it?
Great question. The demand, right? So from a pediatric side, we have to compound a lot of oral liquids, right? Because we have medications that are formulated for adults. And so we have to put them in a form that we can give to like a 5-year-old who can't swallow. So that's compounding pharmacy.
Got it. All right. Now, this one I've wondered for a while. There are a sea of what am I thinking of supplements out there. You've got and also vitamins, and they're all kind of the same. Like, how on earth do you make sure that some of these don't have interactions? Like, do some of these have interactions? I'm going to ask you 5 questions in once, but let's start with the vitamins.
Yep.
Are there vitamins that have interactions with a lot of medications?
Yes.
All of them? Okay. Simple answer. Long question.
Yes. Vitamins are great. Supplements are great. And I think now there's a fad of perimenopause. Right now we're taking a bunch of supplements, and I personally take supplements as well. I think the important thing, yes, vitamins and supplements are so important to your overall health, involving your pharmacist or your provider to make those decisions.
So whenever you get asked, what medications are you taking? So for instance, I take, as I like to call it, Pepsid. Okay. I take my Pepsid in the morning,
all
honey.
Right, yes.
And so, but should I say all the pills? So they should change that question of what pills, what medications, supplements,
over
vitamins,
the counter,
yeah, are
prescribed,
you taking?
Yes. Oh. And you shouldn't, vitamins, for example, like vitamin D, that's a really important. I work in a hospital. I don't get exposed to sun all the time, so that's a really important med for me to take individually. But I did that before, talking to my physician and making sure that it was correct with all the other meds I'm taking. Also, there's combination products, and so that's something to be careful with in that, if there's a little bit of magnesium in this pill and this pill, you might take too much.
Oh, wow.
Right. So you have to think about, like you said, the whole picture. My meds that I get from my physician, and then things that I can pull off the counter and take myself.
So is there a class of drugs that tends to be more, to react more? Or are they all it's just kind of a crapshoot?
I would say the biggest ones, they're called cations. So they're.
That sounds delicious. That sounds delightful and furry.
I know, and you have cats. Let's nerd out real quick. So a lot of our elements that are positively charged, so in their elemental state, those do a lot of binding to certain medications. Yes. So you hear don't, take this med, like thyroid meds, don't take it with a meal. And that's because they might have calcium or magnesium in your meal that will bind up to the medications.
And make it not be able to absorb it or something.
Exactly. All the things. So yes, there are certain food groups, meds that you would not want to take with other meds.
Okay.
Exactly.
Interesting.
Yes. Uh-huh.
We're going to listener questions now. And actually one of these, the listener got in, and it's a question I have. What's the deal with grapefruit juice? Because it's like my grandfather couldn't drink it. Now my mom can't drink it. What's the deal with grapefruit juice?
I know grapefruit juice. Grapefruit juice has a bunch of interactions with certain meds, making it either not able to be metabolized correctly or causing your stomach and your intestines and your liver are kind of big components when you're breaking down a drug. And so when you're altering like the acid base ratio in your stomach, that impacts medication. So you won't be able to take it. Your liver enzymes, those are things in your liver that help break medications down into their active form.
Okay.
And so when you have like grapefruit juice, it can kind of impact those enzymes, either like making them too fast or too slow. So you either are rapidly metabolizing a drug incorrectly, so you're not getting the full effect, or you're slowing it down where you're having a problem with like side effects of staying in your body too long.
So if you were to have like, if we were able to stomach lime juice, would you say the same thing?
I think it just depends on the medication and then the food that you're taking. Yeah.
Okay. All right. If you were about to go on a trip, what would you pack in your travel bag? First aid bag.
That's a great question. Obviously, if we're packing light, prioritize your prescription meds. So I'd probably leave my supplements at home and making sure I take my prescription meds in their original container.
And would like, because I know sometimes you like, I just went away for 2 weeks not too long ago. And how many would you keep in your purse versus in your suitcase?
Don't keep it in your suitcase. Keep it on your carry-on. You don't want to lose. And then also maybe work with your pharmacist and get a couple extra, or like if you have some, and take more in case there is a delay in travel, especially meds that are really essential to your health and you need to take every day. But I would prioritize what meds I take. But then also just kind of like a nice to have when you're traveling, Tylenol, ibuprofen, your Pepsid, Dramamine if you get car sick or motion sickness, that kind of thing.
You can't take that one with alcohol. I made that mistake once. That should not be street legal, girl. It was a lot.
Any medication that's like acting in your brain and then you add on alcohol, it's probably going to have
I forgot I had taken it. And then all of a sudden I was like, I feel great.
But for me, so I have a 10-year-old son. He has allergies. So I always make sure I have Benadryl.
Yeah, I always carry Benadryl, kids Benadryl in particular,
And then to that kid point, Tylenol and ibuprofen, making sure you have like chewable formulations.
Yeah, good idea.
Yes, because liquid's kind of hard. That's what I have at home. But when I'm traveling or, in my car, I have like chewable formulations of different meds. Yeah. Mm-hmm.
Okay, smart. One of our listeners recently started taking insulin. What's the correct way to dispose of those needles?
Ooh, great question. We get that a lot. Obviously, we want to keep our environmental service, our trash collectors safe. So we never want to put needles into a trash can, tie it up and go. So yes, we have sharps containers available for purchase to dispose of needles, but not everybody has those. So any type of laundry detergent jug or any type of hard plastic that you can put in and screw on and dispose of that.
That's a good idea.
You just want to keep the people that manage our trash safe and not have an accidental poke.
I never thought about that.
Yeah, anything hard plastic that it can't poke through.
I just want to say to any garbage person or sanitation worker, thank you.
I know,
That's
right?
scary.
Can you imagine what they see? Yeah.
Yikes.
So let's protect them.
Yeah. What about pills? How do we dispose of those? It's like, what if you have some expired ones that you can't take? What are you supposed to do with them?
Great question. A lot of pharmacies have take back programs. So at WakeMed Raleigh campus and then also in Cary, we have these big green bins that you can come and just throw your meds in. And we partner with a company that takes them and disposes of them correctly and safely for the environment.
That includes liquid too. I know this was about pills, but like any medication.
Any medication. Yes, exactly. So that's a great way. So number one, I would say Google a take back program that's close to your home. If you cannot do that, the key really is to make sure when you're disposing it, yes, you can put it in the trash, but make it in a way that it's not usable, right? So like mix it up with some leftovers that you're throwing out.
Smart.
You just want to make
put it in the cat food, y'all.
Put it in the
wet food,
in wet food or dog poop or coffee grounds, whatever. You just want to make sure it's in a form that can't be reused.
That makes sense.
Yep.
Last question. I take HRT, hormone replacement therapy, and it comes in a sticker.
It comes,
And I had to change my patch out on Saturday, and I was like, I wonder if like all of our drugs could be in a sticker.
Oh, that's a great.
Like we would look like, like a NASCAR driver.
Yes.
So what is the deal with stickers? Is this a new frontier in medicine? Because I've never seen a sticker medicine before.
Yeah, a patch. We do have a lot of medications that are in the patch formulation. But to not geek out on you too much, it depends on the size of the molecule and if it can be absorbed.
That makes sense.
In a potent way into your systemic. So you have a patch and it's getting absorbed through your skin and entering your bloodstream. So if a molecule is really, really big, it might not be able to do that. So that's why, they have all these really smart people with research and development that know on a molecular level how this drug will be most effective from an absorption standpoint to then do what it needs to do.
Because it would circumvent like the lactose intolerance and anything else you can't take in a pill.
Right, exactly.
But then
that's when you need a compounding pharmacy that can make it special for you.
Oh, yeah. Yes. And then you can look like a race car driver with all your patches on.
Exactly.
I found it really fascinating that you really should get your pharmacist's opinion whenever you're buying any kind of supplement or vitamin to make sure it doesn't interact with your medications. Thank you so much to Dr. Mary Covington Coleman for your time today with us. And if you like our podcast, please tell a friend or rate us 5 stars because it does help people find us. And until next time, be well, everybody.